Thank you again, Susie, and thanks for presenting this information here for us today. I think what Susie has just presented is quite grim, quite stark. Ireland was already a significant outlier in terms of drug-related deaths compared to any country in the EU. I've no doubt that this information puts us further behind in terms of this. So if ever we needed a wake-up call as a society, as policymakers, as legislators, that we need to get our act together in relation to this whole issue of drug use, I think that information is very compelling. And I think it does set in the importance of this assembly and the opportunity that we have to influence and act with urgency and make our recommendations. But it's quite grim, it's quite stark. I think it sets a tone for deliberations quite importantly today. So thank you very much, Susie. Okay, I'm going to pass now straight away to Jim Walsh. Jim is the lead official in the Department of Health on the current policy, and he's going to outline what the policy is and where we think we can evolve it from now. So Jim, over to you. Thank you.
Good morning, everyone. Thank you for the opportunity to present a strategic approach to on a health-led, a strategic perspective on a health-led approach to drug use. So I'm not outlining what the Department of Health believes should be in the next drug strategy. That's not what I'm here to do. That's your remit. What I'm here to do is to offer to you some insights and perspectives which I hope can aid your deliberations and recommendations. So our drug strategy is coming to an end. It's due to end in 2025. And I think we have an opportunity now to see what could we put in the next strategy, which coincides nicely with your period of work and the timeline outlined earlier on. So there's an opportunity to shape the next strategy. And what I want to do is throw out some ideas and give you a sense of what I think are some of the opportunities for you to make a strategy that is better, more effective, and more health-focused. And the opportunities I have identified are informed by policy developments at the EU level, in the British-Irish Council, where we have a drugs and alcohol work sector, the Council of Europe. But they also reflect developments in health policy at a national level. And if we want to have a stronger health-focused drug strategy, it needs to be better integrated and aligned with overall health policy. And I want to highlight some new ideas and developments in that context. So I have around 10 suggestions, and I'll run through those as quick as I can. So my first suggestion is to incorporate in the next strategy a rights-based approach. So we already have a right to health, and that is the right to the highest attainable standard of health. And this is, I think, really relevant to people who use drugs because their health outcomes are so poor. So if we can take this right, strengthen it, I think this will be of benefit. Indeed, in the existing strategy, it actually goes a bit further, and it talks about the right of people who use drugs to receive person-centred care and to be involved in the development of their care plan. And we've also seen some interesting work funded by the Irish Human Rights and Equality Commission to promote the rights of methadone service users. So let's put the issue of rights centre stage in the next drug strategy. And that's where we build our policies from. And a rights-based approach would obligate a health-led drug strategy to prioritise those with the greatest needs and to ensure that nobody is left outside or left behind and no discrimination takes place for reasons of stigma or otherwise. Now, we also have a right for children related to drugs, and that's part of the Convention on the Rights of Children. And here the right is to protect children from the illicit use of drugs and to prevent the use of children in the trafficking of such drugs. And I think there is huge potential to take that right and insert it centre stage in the next drug strategy. And I think this would help to provide a strong rationale for prioritising measures that benefit children who are most at risk of being impacted by drug use. And you'll know that we actually undertook a consultation with children and young people to inform the work of the Citizens' Assembly, and we've shared that with you as well. And that's because we think this is a really important issue. So my next proposal, which kind of flows from the first one, is to make the involvement of people with lived experience a core component of the next strategy. So put it again centre stage. And this approach flows from a rights-based approach and is well captured by the phrase, nothing about us without us. But there are also practical benefits of involving people with lived experience. We can have more effective services, and we can have new ways of engaging with service providers. So I give you there just two examples of approaches where lived experience is centre stage in the policy approach. One is from the Housing First initiative, which works with people who are homeless, long-term homeless, and it sets out how you can involve people with lived experience. And the second one then is a new initiative in Scotland called the National Collaborative, where they're trying to put people with lived experience centre stage in the policy making process. So again, new ideas, but being tried elsewhere. Can we apply them in Ireland? So in the next proposal, again from a health-led approach, is the issue of prevention. I mean, you know, if you talk about health, good health, the first thing is let's make sure we prevent diseases, illnesses occurring. Preventing a problem rather than treating a problem that's out of control. So from a drugs perspective, we need to stem the flow of people who require treatment, to stem the flow of people who are ending up requiring treatment. And how can we intervene at an early stage to do that? And the key message here is prevention is better than cure, but we need to make prevention of policy a requirement, prevention a key requirement of policy, and fund it accordingly. Now, my next suggestion is about how we can better integrate our drug services with the wider healthcare system. And health system is at the moment undergoing a major change where we're addressing some fundamental problems and weaknesses in our health system. And these weaknesses are also in our drugs policy system. We have what I would call a patchwork quilt of service delivery, which is fragmented, localised and uneven. Sláinte Care, which is the reform programme, addresses these issues by putting in place and emphasising integrated care pathways, so that there is a pathway by which people can navigate through services and get the services they need. There's also then a reform at a structural level, which we should make the issue of drugs centre stage, which is the new health regions. And I also want to flag then another initiative, which I think is really relevant from a drugs perspective, and that's the Healthy Communities programme. And this is our flagship programme to address health inequalities in localised areas of disadvantage. And Paul, you mentioned at the start about areas of disadvantage. So let's link healthy communities, that intervention to address health inequalities, and build it into our work and develop synergies. So my next point is about the issue of services for women. I think we now realise that we can't have a healthcare system that doesn't appreciate and understand the different health experiences and health issues that women face.
Just 1 minute, Jim.
And this is very clearly the case also in the drugs context. So we have some good ideas and good proposals about a kind of a gendered perspective on drugs. We have localised initiatives. We have good guidance. I think we should avail of the opportunity to maybe put drug services at the vanguard of providing good healthcare services for women who use drugs. My next point, and I'm running out of time, is the issue about commencing the health diversion programme. So this is a programme that was agreed by government in 2019, ministers of different departments, where we set out a clear roadmap for diverting people who are found in possession of drugs into the healthcare system. It's an excellent model. It's a model that we've put in place from a health perspective. It's open for business. We have the infrastructure in place. What we need now are people to be referred to that system. And that's our gap. We have a gap. Here is an easy win. If we can divert people found in possession of drugs from the criminal justice system to the health system, what's bad about that? And we talk about the Portuguese model. We'll hear about it later on. Here we have an Irish model on the shelf. We just need a bit of energy to make it work. Go back, maybe I'll finish this.
I'll ask you to finish now, Jim, yeah, please.
Yeah. We've just had a talk on drug-related deaths. If there is anything that defines a health-led approach, it is to address drug-related deaths. These are people dying prematurely, well in advance of when they should die. We need to make this a public health priority. And again, I'll give you an example there from Scotland, where they've established a drug deaths task force, which has made the issue of reducing drug deaths and improving the lives of people who use drugs a policy priority. Okay. Let's do that here and deliver a real health-led approach. Thank you.
Thank you, Jim.